Hello, everyone, and thank you for joining today's webinar on the Children and Youth Evaluation Service, the state-designated independent entity for children's HCBS. Before we get started, I'm going to run through just a few logistics. As always, timelines and information that is shared today is accurate as of today. The slides and the recording will be available on the CTAC website, so you'll be able to access them. Additionally, we do plan to have time for Q&A, so please submit your questions via the chat. If the chat is not already visible on the right-hand panel of your screen, you can access it by hitting the little thought bubble on the bottom toolbar. And so please do submit your questions and make sure that you send them to the host when you are submitting them. And with that, I am going to turn it over to Caitlin Kennedy from DOH, who is going to get our presentation started.
Good morning, everyone. So as Caitlin already overviewed, this is the Children and Youth Evaluation Services, CES, State Designated Independent Entity webinar for Children's HCBS. Today we're going to be covering the transition phase, which is February 1st, 2019 through March 31st, 2019. The purpose of this webinar today is to cover the role of the independent entity, as I said, through February 1st, from February 1st through March 31st. We will be holding a separate webinar to overview the role of the independent entity beginning on April 1st. At the end of the slide deck, I'll give you an overview of the type of content that will be included in that webinar. But for today, we're just going to be focusing on that February 1 through March 31st window of time. The basis of the independent entity. So today, children are transitioning from the care coordination provided through a 1915 fee waiver to health home care management. This transition began on January 10th and must be completed by March 31st. Health home care management is an optional benefit, but HCBS requires a plan of care and care coordination. So in order to permit those current 1915 fee waiver children to opt out of health home care management but still receive Aligned Children's HCBS, the state has designated an independent entity to develop and manage HCBS plans of care. Who is the independent entity? Maximus is the state-designated independent entity. This program is being branded and marketed as the Children and Youth Evaluation Service. CES is the acronym that we will be using. CES can be contacted at 1-833-333-CES, and there is a teletypewriter number as well. A website for CES will be going live tomorrow when they open their doors. Here's the web address. And CES staff are regionally located. So if you'd like to find out where CES is physically located in your area, you can call them and they can let you know where you can meet in person. And down below here, we have the logo for CES, which you'll be seeing more of. The role of CES. For children receiving HCBS who opt out of health home care management, CES will manage an HCBS plan of care. This may include meeting with the child and family and acquiring signatures to the plan of care, adding new HCBS to the plan of care, making referrals to HCBS providers, updating the plan of care and communicating the plan of care to Medicaid managed care plans. But just a note here, the Medicaid managed care plan will monitor access to the care indicated in the plan of care for children who are enrolled in a plan. CES will conduct future eligibility assessments. So from the point that a child is referred to from the point that the independent entity CES accepts the referral, they will be responsible for doing annual HCBS eligibility assessments. CES will only manage HCBS, so families with other service needs, including CFTSS, may work with their providers or work independently to obtain those services. Children who may access CES. Children who are referred to CES during the transition period which is, again, February 1st through March 31st, must already be enrolled in an HCBS waiver for children and must have opted out of health home care management. CS is accepting referrals from HCBS waiver care coordinators through a defined referral process, which we'll get into in the future slides. And transitioning children must have a current level of care. So it's really important to understand that during this transition period, we're only referring children who are currently enrolled in one of the Transitioning Children's 1915C waivers to CES. There's no open referrals for new kids yet. Level of care determinations.
So hi, good morning. This is Colette Pullen. So we just want to be clear what is required for this period of February 1st through March 31st. As Caitlin said, we are in the transition period to get ready for the new children's waiver that will be implemented on April 1st. So right now, all waiver providers should be working with their families and explaining the transition that is occurring and explaining that they can go to health home, or if they do not want to go to health home, they can opt out to go to CES. At the same time, while you're doing this review with the family about this transition period, it's important for you to evaluate where you are with your case of each child and when their annual recertification is due for their level of care. We have sent out clarifying guidance on this change on January 11th. It's posted on the DOH Health Home website. We also sent specifically to the care at home population of providers, we sent out clarification on this as well last Friday. So if you have a level of care annual recertification or determination that is due in January, February, or March, then you will complete that annual determination through your current waiver processes. And I, again, will suggest that you look at our clarifying guidance because each of your waivers have different paper components or different components in it that, determines level of care. After April 1st, the level of care determination is due for an annual recertification or determination. Then it will be completed with the new HCBS level of care eligibility determination process. This is our new tool through the UAS CANS, and we will be having an upcoming webinar regarding this process. So it's really important that everybody understand that you may have attended an in-person training in the last couple months that was conducted by myself, that this is a change to that grandfathering or the 1 year of eligibility. Every child who's transitioning must have a current active level of care determination, which is required for the waiver. If that's due during this transition period, you will complete that according to the guidance through your current standing waiver. After April 1st, we'll give more education on the new process. So want to make sure that's really clear that this is a change of anything you probably learned even up to a month ago. So really important that people understand that. So the independent entity, when Caitlin talks about the referral process, will need to know when the annual recertification is up or due. And if it was due during this transition period, they'll be expecting that paperwork to come with the referral. If it's due after April 1st, then they will be the ones completing that.
Thanks, Colette. So as we mentioned in a couple of slides, during the transition phase, CS is only open to children who are transitioning from one of the current 1915C waivers. So just for your reference, although I'm sure this audience probably is aware, those transitioning waivers are the OMH SED waiver, the DOH Care at Home waiver, the OPWDD Care at Home waiver, and the 3 OCFS Bridges to Health waivers. Making a referral to CES. Only a care management agency can make a referral to CES during the January through March transition period. It is the responsibility of the care management agencies to send a complete referral package using their secure email protocol to cesreferral@maximus.com. The CMA should organize the documents into one package and send the package as one PDF attachment to CES. A complete CES referral packet must be sent and accepted by CES. If the care management agency has to make referrals for multiple children within the same family, the care management agency must send one email per person. So for example, if the care management agency has 4 children to refer from one family to CES, that care management agency should send 4 separate secure emails, one for each child. CES referral packet elements. So a complete referral packet includes all of the following: the CES referral form, the health home opt-out form, which is DOH 5059, the care management agency's consent form, which will allow them to share information with CES, the child's current plan of care with service names crosswalked to new service names, and listing all of the services and providers that the child is receiving. Historic clinical, treatment, and service information, and previous HCBS or level of care assessments, which indicate the due date for waiver eligibility reassessment.
Yeah, just say something.
Yeah, of course.
So I just want to make sure it's really important that folks understand the agency consent form. So you're clear, right? You cannot currently use a health home consent form because the child is not in health home, and you will not be able to use your waiver consent form, like a B2H consent form, because the child is opting out. It's really important, and most agencies, if not all, have some type of agency consent form to share information. So when you're talking to the families regarding their choice of health home or to opt out, if they choose to opt out, that you get this consent form and that you have CES marked on that consent form so that you can share these documents with them. So that's very important. CES will then meet with the family, and then they will obtain the proper consent forms to make sure that they can connect to all the proper providers that you have listed on your plan of care. The other goal is, right, what's really important so that there's not a break of service, that you share as much information as possible with CES, especially those current service providers, contact information, any type of treatment plan, because we really want CES to meet with the family, pick the services up and run with them. We don't want any break or gap in services if a family is transitioning and opting to opt out. That's really important. The other thing regarding the crosswalk of services, we do have on the DOH Health Home website page a crosswalk chart of those services that is in the PowerPoint of the in-person training. So you don't need to do any special research there. We actually crosswalk each service for you. And maybe we can also send that out or attach it with this PowerPoint so that you have that information. So again, it's really important that CES has all the information to pick up that family and not have a gap of service.
Thanks, Colette. Complete referral packets. So just to be really clear about this, The care management agencies are expected to send complete documents that include the child's demographic information and appropriate signatures. The following data elements should be double-checked before sending in a referral: first name, last name, date of birth, social security number, their Medicaid SIN number, their gender, and their address. So it's really important that CES get all of that accurate information. Making a referral to CES. The referral to CES form is posted on the CES website. CES will communicate back to the care management agency either referral accepted or referral declined via secure email. So you will always get a response back when you send in a referral. If the referral is declined, the notification will detail to you the reason that it was declined, such as missing information. So it'll let you know what the problem was. The care management agency is responsible for the child and their plan of care until CES notifies the care management agency that the referral has been accepted. So until you get that notification back saying that the referral has been accepted, you're still responsible for serving that child and for their plan of care. Once the referral has been accepted by CES, then CES is the one that is responsible for the child and their plan of care. Transitioning providers should notify their DOH liaison whenever a child opts out of health home, because the DOH liaisons are tracking all transitioning children.
So this is really important, and we continue to repeat ourselves here that don't wait till March 31st to be sending over a referral of an opt-out child, because if you do not get an acceptance of their referral from CES, then that child has not officially transitioned, and if that is not completed by March 31st, then they will lose services. So it's really important that you're making sure you complete the packet accordingly and you're sending this over to CES when you're ready and not waiting till the last minute, because if you are missing something and you need to gather more information, you want to have the necessary time to do that so you can properly transition the child. And as the DOH liaisons talk to all the waiver providers on a weekly or biweekly period, we are going to be asking how many children have or families have indicated that they may be opting out, so that we can prepare CES for an approximate number of referrals they may be getting. So we want to make sure that every child is transitioned appropriately, counted, and that there's no loss of service. So anything we can do to help you, let us know. And if there's any confusion or issues with families transitioning to CES, you can let your DOH liaison aware of that, so that we can make sure that child gets transitioned appropriately.
Absolutely. So how children may access CES. So from the point that a referral is accepted by CES, CES will meet with the child in their home or in a community setting to perform plan of care updates. So again, when we mentioned earlier that CES has regional locations, if the child isn't comfortable or the family isn't comfortable with CES coming into their home, they can meet in a community setting. CES has a statewide presence and has secured space in most counties. Children and families can call CES at their number. Provider interactions with CES. CES is directly contracted with New York State Department of Health. So this means that providers do not need to take any action to establish a formal or contractual relationship with CES. Of course, we do want to emphasize that since providers will be working closely with CES, informal relationships are really important here, but there's no need to contract with CES. We've gotten that question a lot. All referrals must be made via secure email. CES cannot accept incomplete referrals. If an incomplete referral is submitted to CES, it will be rejected and returned to the referent with an explanation. All referrals must include a signed consent form, without a signed consent form, no information about the specific child can be sent to CES under any circumstance. And in some cases, CES may reach out to contact the referring care management agency with questions. So if they have clarifying questions or if they think that there might be more information, you may hear from them. Medicaid Managed Care Plan interaction with CES. Again, CES is directly contracted with New York State Department of Health, so there's also no need for the Medicaid Managed Care Plan to contract with CES as they would a provider. Medicaid Managed Care Plans must accept plans of care from CES, and CES will be collecting consents from children and families in order to share that information with the child's Medicaid Managed Care Plan. So the next webinar that we host will be on March 18th. You can see that down on this bottom line. MCTAC will be sending around another registration link for that webinar if you're interested. And during that webinar, we will cover the role of CES beginning April 1st. So beginning April 1st, so until April 1st through March 31st, children are referred through the normal pathways to the existing HCBS waivers, including those using the family of one budgeting methodology. So if you have a kid who's newly trying to access an HCBS waiver, you follow the same processes that you do today right up through March 31st. Beginning April 1st, CES will accept referrals to assess children who are not Medicaid enrolled to determine eligibility for the Consolidated Children's HCBS waiver. CES will assist children who are determined HCBS eligible and meet other specific criteria in applying for Medicaid with the LDSS, including those who use the family of one budgeting methodology. So again, there's no change to any processes until April 1st, and then on April 1st, those children who are not enrolled in Medicaid can go to CES for an HCBS eligibility determination, and CES will conduct that determination and facilitate assistance with the Medicaid application. CES will continue to be available to develop and manage plans of care for children who opt out of health home care management and are not enrolled in Medicaid managed care plans. So even after April 1st, you can still opt out of health home, and CES will still be the resource that will manage the plan of care for those children. So again, the next webinar is March 18th. So we look forward to speaking with you all then. So I'm going to put us on mute for a moment, and we're going to review the questions that we've received so far in the chat box. And in a moment, we'll jump back on and start to answer those for you.
As we move into the Q&A portion of today's presentation, just a reminder that you may submit questions utilizing the chat feature on the right-hand side of your screen. And as we have a number of questions coming in, the presenters will do their best to answer as many as they can. If you have additional questions after today's webinar, please submit those questions to the Behavioral Health Transition mailbox, which there'll be a slide up here shortly that gives you the address for that. And so again, just going to wait for our presenters to gather the questions that have been submitted, and we will be back with you shortly. Thank you.
Okay, so we have a number of questions. The first question is, will the CES phone number and website be posted? So this slide deck obviously will be posted as mentioned earlier on CTAC. The DOH Health Home and Behavioral Health website has a 1915C resource page, so we will definitely put the phone number in the website also there. We can also ask our state partners to list that on their site so that people are aware where that is. So it will be posted in multiple places to make sure that folks are aware of that. And there's been a question, did the current care management agencies or waiver providers receive the referral packet or this information like the phone number and website? And I would say no, this is probably the first time everyone is seeing the website and the phone number. So you should not have received anything prior to today, and we'll make sure we send out a listserv blast and other things to kind of publicize CES. In addition, there's a question about the transitional rates applying for youth that are enrolled in CS or just health home care coordination. So transitional rates are for OMH, SED waiver, as well as B2H, OCFS waiver. And letters went out on Monday, what's today? Yesterday, Wednesday, and Tuesday. And please read the letter because it's very clear that you need a health home bill for someone. So any child who opts out and goes to CS, you will not be able to tack on a transitional rate. However, remember the transitional rates are not tied to a specific child. It needs, so please read the letter and look at that PowerPoint for the answers of those questions, or submit questions about the transitional rates if you need more clarity. There's a number of questions about services like private duty nursing or CDPAP services. Who will authorize or coordinate these services? So it's really super important, and lots of information has gone out about this as you educate your families in waiver about their option. Their option is comprehensive health home care management, where all the needs and services of a child will be coordinated by their care manager. If they opt out, CES will only be managing or coordinating services that are home and community-based services. So private duty nursing are state plan services. If they're in the new child and family and treatment and support services, those are state plan services. So it will be up to the family and other providers that they're connected to assist them in either getting into new services or arranging for authorization. So it's important for you as a waiver provider to explain the two options to the family, but also, talk in context with them about the services they already have today and the work you're already doing for them. So if you have a really self-sufficient family and they know their providers and they're moving through the services with little to no help from you, so to speak, then that may be an appropriate family for CES if they choose that. But if you're doing a lot of care coordination for a family, especially for non-home and community-based services, and you might want to talk to the family about that they will lose you as doing that role for them, right? That one main contact to coordinate their services. With CES, they will not get that because CES is only contracted to conduct coordination of home and community-based services. So really important that people and families understand what they are not getting if they opt out of health home. And the only options are those two options. It's required that if you have home and community-based service waiver services, that you must have some type of care coordination. And for April 1st moving forward, these are the two options: health home care management or the independent entity of CES. So that's really important that families understand that. Also, as you transition your children, there's a question about the referral packet. There's no need to backdate or anything like that, like the health home program, because remember, you are not billing for that child. Really important for you to understand that once you transition that child to CES, you are no longer serving that child and you are no longer billing for that child in the future, right? Current and in the future. You may, obviously, if you served them a month ago, you can always back bill for those services. So there's no need to do any billing or backdating of anything. Once you have that accepted referral from the independent entity, then that child is technically officially transitioned and ready for April 1st.
Okay. We got a couple of questions about how long it will take care management agencies to hear back about whether their referral was accepted or declined. And the standard turnaround time for that is 3 to 5 business days. We also got some questions about what the educational requirements are for Maximus staff who are doing the evaluations and what training and qualifications they might have. The evaluators are nurses, so they're familiar with the type of terminology that's being used here, and the state has been providing training to Maximus.
So there's a couple questions about the level of care. So I want to be clear as I can, because all 6 waivers do something a little different. So it's a requirement of HCBS that you have an annual level of care determination. And so that is the date you will be using. So we have some questions about the LGU signing off, 6 months assessments, the health home has a 6-month assessment, things like that. So I think we need to separate all the different types of assessments and sign-off periods, and I think you need to focus on what is the due date for the annual level of care determination recertification, and then that is the date that you will be using regardless of other assessments that may be conducted within 6-month period. So we have an example here that the child had a level of care recertification that was due in September 1st of 2018, but they've also have an assessment, waiver assessment for their waiver expiring on March 1st. So that is not the level of care. The level of care would be due August, right, because it's 12 months, August of 2019. So you would not need to do a level of care during this transition period. So I want folks to be really clear about that. If your annual determination is due during this transition period, so it is due January, February, or March, and you complete that, then the question is that the time frame that you use for next year? Yes. So we're keeping the annual determination for level of care at the same time. It's still annual, right? So 12 months. So if you complete that level of care determination here in February of 2019, then it will be due next January in 2020, okay? So I think we just need to be really clear what the difference is between level of care annual and the various assessments or other maybe Medicaid requirements and things like that. Those due dates are different than the level of care due date that we're talking about. So there's a question or asking what the CSPOA's role is on relationship with CS. So again, maybe we need to state this a little more. All our current referral pathways that the various waivers get referrals today, we are not changing now during the transition period, nor after April 1st, right? These are some content experts. They already have connections in the community to get referrals for waiver services. Okay, so it will be the role of the independent entity CES to make relationships with those, like the CSPOA, so that there's a coordination or a handoff at those different points. So as Caitlin mentioned, CES or the independent entity will have a new another role, right, come April 1st, and she'll be doing that webinar, as she mentioned, in March. Regarding that role of in the new world of April 1st, but we are not changing any referral pathways. So the CSPOA, we know, have lots of connectivities to clinics and hospitals, and we will be educating all of you as you get those referrals for waiver services, how you will work with the CES and how you will hand that off to them for various like family of one determinations and things like that. So I want to be really clear that we're not changing any of those pathways that are occurring today, and they will be an important role as we move forward in the new world to make sure that we connect all the waiver children with the possibility of being determined waiver eligible and being connected to services. So there's a question why CES needs the Social Security number as well as the SIN number. And again, we're having a webinar on the other part of or role of CES, and they will be managing the family of one population. So some, of course, those families that get referred to them will not have a SIN number yet, so we would need a way to identify those children. And of course, those children need to be looked up in various systems like eMedNy and ePaces or the Health Home Tracking System. So it's really important that you provide the Social Security number and the SIN if you have both, and if you don't have both, that you provide the Social Security number. We just think for consistency purposes, it's easier to say whatever you have, please supply, so that the member, the child, can be properly served.
We have a question here. Will CES assess and develop care plans for children who are enrolled in Medicaid managed care plan but opt out of health homes? And the answer is yes. It doesn't matter whether the consumer is enrolled in Medicaid managed care or in fee-for-service Medicaid. CES is available to all of those consumers who are HCBS eligible.
So there's a question, is CES able to, or are you able to refer children who don't currently have Medicaid? So the answer would be no. During this transition period of February and March, CES is only taking children that are already in waiver, right? So they're already receiving waiver services and they're in waiver. Now for the OMH, we know that you have some kids who are preliminarily determined eligible, but you're still waiting on the Medicaid. So that child is not considered a transitioning child at this point, right? So you need three things for the child to be considered a transitioning child. So they need a current level of care, they need a current HCBS plan of care, and they need to be receiving an HCBS service, and they need to be, so I guess 4 things, and they need to be in Medicaid. So at this point, any child, unless they have those 4 things, are not considered a transitioning child at this point, and they will not be transitioned to CS if the family chooses to opt out.
There's a question here about whether children can still continue to see their current HCBS providers if they opt out of health home and are served by CES. Yes, those children can, there's no disruption to the providers that they see as a result of opting out of health home. The provider availability is the same. If they're in fee-for-service, they have to see a designated provider, and if they're in a Medicaid managed care plan, they have to see a designated provider who's in network with the plan that they're enrolled in. So there's no impact on what providers the child can or will see based on their health home opt-out status.
So there's a question on who completes the level of care after April 1st. So we're going to do some training regarding that. So if the child is in a health home, then health home care managers will be conducting that, or if they're with the independent entity, it will be CES that will be completing that. And in the new world, for new children, it will be the health home care managers, CES, or the DDRO. So we will be providing some upcoming webinars and trainings regarding specific stuff about the new world of April 1st and beyond. So again, I want to make sure everybody's aware we're really talking about just these next 2 months for CES and during this transition period of children who are currently in waiver services. Because remember, all the work you're doing right now is to transition kids is to prepare them for April 1st.
There's a question about how referrals can be sent to CES. The only way to submit a referral to CES during the transition phase is to send a secure email to cesreferral@maximus.com.
So there's a question about the cans and 60 days and things like that. I want to be really clear that we're talking about the independent entity and CES. So these are for waiver children who opt out of health homes, so you will not do a CANS, right? So I want to be really clear. There's a process, a step-by-step process, how to transition a waiver child to health home. And then there's a process, step-by-step process, which was just outlined in this webinar for you, of how you transition a child to the independent entity of CES. So that's really important for you to understand. If the family opts out, you will not be completing a CANS. You will be doing this referral packet process to make sure that the independent entity will be serving that member, that child, that family. Okay, so there's a question about early intervention. So again, really important for everyone to understand, any service that the family has or needs that is not HCBS, is not home and community-based services, will not be managed by CES. Really important. This is the main point people have to understand. So if a child is also in early intervention, CES will not manage them. They will have to go back to the county or the provider of early intervention for them to get those services there. We are going to be posting some guidance around early intervention and the health home program, and we will also make note that if a child opts out, that is not their role of CES. So it's really important that families understand what it means to opt out. Okay, so there's a question about clinical information, like what is the expectation to forward to CES clinical information that you can't re-release clinical documentation. So it's really important that we give CES as much legal PHI information that you can for them to be able to not start from scratch with the family, right? And so as a waiver provider, you may have done an assessment of your own. Some of you use a form of the CANs, or you may have other medical assessments or determinations, doctor's orders, things like that. So it's important that if you can't re-release the clinical information, that CES understands who the clinician is that is providing either services or treatment, and they have contact information. If there was assessments that were done, that it's noted what type of assessments have already been done, and then CES will get proper consent to talk to those providers and obtain it. But I know that waiver providers also have a number of documents that they can pass on, or that you have done yourself that you can have passed on. So the goal really is to try to give CES as much information as legally possible so that they, again, can pick up the case, so to speak, and contact providers and start working with that family without starting from scratch, right? Because that would be very frustrating for a family to start all over. So it's really important. If you're concerned about that, you definitely can make that referral, and then you can follow up a call to the CES and have a conversation with them. If you want to do some other warm handoff or something like that with CES, all those options are open to you. This is really what the minimum is required, but just remember, you have to accomplish all those tasks before March 31st, right? So it's really important that CES gets the referral packet and has accepted it before or on March 31st. So there's, I would say, about 3 or 4 questions about after on 4/1, what will CES be doing, and about eligibility for Medicaid and family of one. So we're not going to answer those questions today because we don't want to confuse folks, and we are maybe still working on some processes. But as Caitlin mentioned, there is going to be a webinar on March 18th yep. About the new world of 4/1. So sorry, please be patient. We want to make sure, right, that our focus right now is really to make sure all these children who are currently receiving waiver services are properly transitioned to Health Home Independent Entity of CES so that they do not lose services. All about hope. Okay, so there's questions about where will the state post rates and reimbursement for the for the IE. I want to be really clear. Caitlin said it in the beginning, I believe, is that the New York State Department of Health has a contract with the independent entity, so there will be no rates posted or anything like that. Once you have handed the child off to the independent entity, you are no longer responsible for that child, and then it goes under our contract with them. So, and again, the services that they will be providing is case management services or care coordination services of only the home and community-based services, right? Connecting providers to meet the needs of the child for home and community-based services. Yeah, so we're just scanning the question, and it seems like a lot of the other questions, like I mentioned, are really about what happens after 4/1. And so, again, we will come out with details and information regarding the new world of 4/1.
Yep, so just to reiterate one more time, until March 31st, the only referrals to CES are consumers who are currently enrolled in a children's HCBS waiver who opt out of Health Home.
So I want to be clear because I'm just reading some of these questions. Your current waiver is in place, right? So anything that you do for your waiver services today are still required unless you have been given guidance from OMH or OCFS or OPWDD, unless you have been given guidance saying that you don't have to do something, you are still required to do what you need to do. Your waivers are open for business, for services, or whatever, till March 31st. The new children's waiver does not start till April 1st. So until such time that you transition the kid to Health Home or CES is when new requirements may be required. And as we mentioned, once you transition the kid to CES through this referral process and you get an acceptance, then the family is no longer your responsibility. They are in waiver services under CES. So I just want folks, because there seems through the questions that people are confused about the plan of care and do you still have to do a CANS and things like that. So it's really important that you stay in contact with your waiver state partners. And if you have some of these questions, you can reach out to them or the DOH liaison that you have to answer questions about your current waiver or the current process to Health Home and what is needed for Health Home, because again, there's a number of Health Home questions that we have as well. And I also want to make sure that everybody understands every single child in waiver that meets a transitioning child definition must be transitioned by March 31st, regardless of their insurance, whether they're in Medicaid managed care or their family of one or anything like that. All children in waiver who meet the eligibility as a transitioning child must be transitioned by March 31st to either the Health Home or CES, and that is the choice of the family, right? So it doesn't matter. Again, if they're a family of one child, they do not automatically go to CES, okay? You need to talk to them if they want to stay with you as a care manager and move into Health Home, or if they want to opt out and only get care coordination for HCBS and go to CS. So again, I think some people are mixing up the new world and what CES will do in the new world for family of one. And this is why we don't want to talk about the new world, because it can be confusing. So you currently have children in waiver. You're going to tell them, educate them. We have letters, pamphlets, brochures out there, how you can explain what's happening. You're going to explain this transformation, no gaps in services, continued services, right? They have a choice to go to health home or CES. Regardless of insurance, family of one, or whatever, they have the choice. Really important that folks understand that.
Colette, I think we might have time for one more question, if there is one.
I'm scanning them, and I think a lot of them you have either been answered. Folks are asking about the secure email, so I think we're going to post, like Caitlin said, the email, the website, the phone number, and all of those processes, and we'll make sure we do a listserv blast so everybody has the information, and then this PowerPoint is also going to be posted. So other than that, I think we're good. Are we good, Caitlin?
Yes, we are. Thank you.
All right. I'd like to thank everyone for attending today's webinar. Again, just a reminder that the slides and recording will be made available on our website shortly after today's presentation. I'd also like to encourage you to please visit our website at mctech.org to stay informed of upcoming offerings and access a number of resources and tools that are available. On behalf of MCTAC, we'd like to wish you a great rest of your day. Thank you, everyone.